Our next speaker is Karen Burns. Welcome, Karen.
Thank you.
Karen is the MHCC Board Chair. She is also the CEO of one of our 4 participating host organisations, UnitingCare Mental Health. Thank you.
Thank you, Tina, for the opportunity to speak about the practice placement program. UnitingCare Mental Health has been providing opportunities for students to engage in practice placements for many, many years, and we feel it's a fundamental role that we provide as a community managed organisation to contribute to the professional development of students who will also be our workforce of the future, we hope, through opportunities such as this. I'd like to speak about one example with one university where we, over the last number of years, have had the opportunity to provide placements to medical students in partnership with the university, and it's been a wonderful experience for both ourselves as UnitingCare Mental Health and the students. The students have been able to engage with programs across the community that keep consumers well and support their recovery journey. And they've also had the opportunity to work with a diverse range of staff, from support workers, peer workers, psychologists and other GPs themselves. And that's allowed them to have the opportunity to understand how a community managed organisation functions, the role they play within the mental health sector, and also speak to these staff to understand their experiences of working within a community managed organisation. It is also really important to speak about our staff of the future, to have the opportunity to expose students to the role of the community managed sector, to be able to contribute to their experiences as a student and support them on that journey to their qualifications, is something that not only do the students benefit from, the organisation benefits from as well.
Karen, thank you. I remember a story you shared about one of those medical students walking up to you one day.
Yes.
Yeah. Do you recollect that?
Yes, I do remember that story. This was a young man who was a very studious young man who gave an example of spending some time with one of our clients in a supported accommodation service. I happened to see him a number of hours later, and he ran from one side of the building to the other, sharing with me that he had learnt something, and he'd learnt something with meaning. What he'd learnt was that sometimes the information that appears in a textbook is not how consumers present in reality in life. And that he had misinterpreted the interaction that he had actually had with that consumer, but to his credit he had reflected on it for a number of hours and realised that the opportunity provided through the placement and the interaction not only with the consumer but with one of our peer workers had led to a greater in-depth understanding for him of the reality of the lived experience of a person, not just a philosophy and a model within a textbook.
Recovery is possible.
Recovery is possible.
Hope, yeah,
yes.
Beautiful. You can't teach hope, can you?
No.
You have to experience it, I guess.